Welcome to This Week in Health IT News, where we take a look at the news which will impact health IT. This is another field report where we talk with leaders from health systems and organizations on the front lines. My name is Bill Russell, healthcare CIO coach and creator of This Week in Health IT, a set of podcasts, videos, and collaboration events dedicated to developing the next generation of health leaders. Are you ready for this? We're going to do something a little different for our Tuesday Newsday show next week. We're going to go live at noon Eastern, 9 a.m. Pacific. We will be live on our YouTube channel with myself, Drexta Ford, Sue Shade, and David Muntz with Starbridge Advisors to discuss the new normal for health IT. With you supplying the questions with live chat. Also, you can send in your questions ahead of time at hello@thisweekinhealthit.com. I'm so excited to do this, and I hope you will join us. Mark your calendar, noon Eastern, 9 a.m. Pacific on April 28th. If you want to send the questions, feel free to do that. And you can get to the show by going to thisweekhealth.com/live. This episode and every episode since we started the COVID-19 series has been sponsored by Sirius Healthcare. They reached out to me to see how we might partner during this time, and that is how we've been able to support producing daily shows. Special thanks to Sirius for supporting the show's efforts during the crisis. Now, on to today's show.
Hi, everyone, and thanks for joining This Week in Health IT. I'm Drexta Ford, CI Security's Chief Healthcare Strategist and President at Drexio Innovation Network, and today we welcome Vic Arora, Chief Information Security Officer at Hospital for Special Surgery in New York City, to This Week in Health IT. Thanks for being with us today, Vic. I know you're crazy busy, and I really do appreciate you being here.
Thank you very much for the opportunity. Happy to be here.
Yeah, we start, if you would, by telling us a little bit about HSS and you and your team there. And, obviously, I'm sure everybody wants to know how it's going with the COVID outbreak there and what you're seeing at HSS.
Sure. So HSS is an orthopedic and rheumatology hospital. We're rated #1 in US for the past decade or so. We're the oldest orthopedic hospital in the country. We also rank very highly in rheumatology and musculoskeletal health. Mm-hmm. So in the past few weeks, ever since this crisis has started, we have literally repurposed our entire hospital operations, from starting with initially deferring our scheduled surgeries to canceling elective surgeries altogether. And then from that, we took on a step to start doing ER patients, which we normally don't do, as an overflow from New York Presbyterian. And then as a second level of maturity, we even started taking care of COVID patients. So we have literally stopped everything we normally do and repurposed ourselves to support the community and do what's needed at the moment. So it's been a transformation of the organization.
Wow. It's incredible too. I mean, and just kind of watching from afar, right? I'm in Seattle, and so we sort of started with the initial outbreak here, and obviously it's sort of gone across the country. You guys have been super hard hit, and it's been amazing and inspiring to watch how you guys have transformed in just a couple of weeks into almost a completely different kind of hospital than you are normally.
Yeah, and there's no way we have the right level of gratitude and the words to express what the care providers, the nurses, the support staff, everybody has done. It's beyond unbelievable.
It is incredible. I'm sorry, go ahead.
I was just saying it's truly a privilege to support them in any way, shape, or fashion. So yes.
Thank you. I mean, the other thing I would say is thank you. I'm a big believer in the what I think is the reality that people who work in healthcare IT, people who work in the CISO's office, are partners for the delivery of great care to patients and families. And you're as much of this as anybody. So, I would just say, on behalf of me, on behalf of the listeners, thank you. You guys have done amazing work out there. What are you seeing with regard to threat activity during the pandemic from a security perspective?
So we are seeing activity in primarily 4 areas that kind of bubble up for me and my team. The first is obviously phishing. We've seen a rampant increase in email frauds related to protective equipment, to the payment protection plan, the stimulus fraud, the CDC WHO advisories. Whatever's in the news is making an email a phishing scheme out there. To give you some numbers, we see on an average north of 50,000 COVID-related phishing scams that are blocked at the perimeter.
50,000 per day?
No, in a week.
In a week, okay.
Yeah, that's what we see. The second area that we've seen an increased activity is exploitation of anything that is public-facing. People are out there looking for ways to get into hospitals, even though some groups have claimed that they're going to refrain from sending out ransomware.
Right.
I don't trust it. And in fact, I've seen some trends where there has been an increase in ransomware activity. So any exploit, any public-facing asset, we see a lot of scanning, looking for vulnerabilities, including the VPN infrastructure. The third thing we've seen is, given the immediate needs, on-the-fly IT engineering or bypassing corporate solutions for telehealth or collaboration, people switching from corporate communication tools to like WhatsApp or other insecure collaboration tools. So that's the third risk. And lastly, I've seen an uptick in onboarding vendors without all the checks and balances, given the supply chain challenges that we have. So these are the four areas that we are focusing on. We've been in the past few weeks.
Yeah, I mean, given the amount of activity that we've seen in the last 4 weeks, and the need to bring on new vendors and buy equipment and do all of these things, I mean, it's one of your 4 items. How are you dealing with that? How are you sort of maintaining that balance between, we have to be able to support the mission and we also need to be secure?
No doubt it's challenging, but like I mentioned earlier, given the challenge that the care providers and the doctors are up against, I think it's very inspiring, and that helps us feel a part of a very unique opportunity, as well as find the inspiration that's needed. But at a very high level, I think the investments we have made in foundational practices prior to COVID, such as having governance, change management, formal risk acceptance by business units, they're all yielding dividends now. I've always been a big believer of cyber hygiene, because the 2 things it will do for you is it'll help you come out of an incident sooner, and it'll minimize the impact of an incident. So all those foundational practices have helped us tremendously. I'll give you an example. Ever since the crisis has started, we still have not missed or postponed a single change management meeting in the organization that happens on a weekly basis.
Fantastic. That's amazing. And I'm totally with you. I think this whole idea of, security is all about security, is kind of baloney, right? Because in a lot of ways, having good cyber hygiene lets you run better, more efficient operations. It sounds like you feel the same way.
Absolutely. And the second thing that has helped us, Drex, is early on in the crisis, HSS at an organizational level, since we were going through such an organizational transformation, they put in new principles to deal with the crisis. And the principles were primarily protecting our staff, protecting HSS, and protecting the community. That really helped restructure how we approached our projects and deprioritize efforts and maintain alignment through the organization. So between that and the foundational practices, we've been able to create the necessary bandwidth. I can get into some tactical things we are doing too, but let's see.
I love the principles. I mean, I think that that level of leadership and transparency to the team and the community is huge, and it certainly has to make you feel good as a CISO that protecting the staff and protecting the patients, that's really what we're all about. Has to feel good that leadership has your back.
Absolutely. And I think the biggest and the most important asset, if you're strictly speaking in terms of risk management, the most important asset that is at risk is people, because of the crisis. If as leaders I'll tell you, I mean, my wife and I, we've been working from home for the past few weeks. Both of us work in the city. We have a 6-year-old and a 2-year-old. Our nanny stopped coming 3 weeks ago. And we had a few failed starts in terms of managing the kids, the homeschooling and daily routines. And then we found our rhythm. But I'm trying to be as cognizant as possible for my team at work, because they don't care how much you know. They only care, I mean, if they felt that they're being cared for by the leadership. So being cognizant that they have similar challenges at home can go a long way in earning their commitment.
That's great advice. Hey, one of the things that I wanted to ask you about, Vic, was to do the follow-up on some of the tactical things you said that you were doing from a security perspective, and best practices around, protecting the organization, protecting the people, protecting the community. So any of those that you want to talk about that you'd like to share with listeners? We're all about trying to spread the news of great best practices.
Absolutely. So I can mention 3 things. The first is we repurposed the security team to move people from our, and apologize for the background noise.
It's fine.
We repurposed the security team to move people from our engineering and operations and architecture groups into governance, risk and compliance, and security monitoring. Our GRC and security monitoring are the 2 units that are more actively involved than operations and architecture, because a lot of projects have stopped that are not COVID related. That has helped us create some bandwidth. The second thing is we have been always trying to do a risk-based recommendation. So we are providing quick feedback to anybody who is looking at a consumer-grade technology to meet an immediate need. And we're also trying to lead the digital efforts where possible. I'll give you an example, 2 examples there. One is a group needed to use temporarily a scheduling app called Doodle. And because of the governance, it came to our shop that, hey, can you do a review? And we said, we will dedicate somebody to set up Doodle for you instead of doing a review, because, I mean, it's a consumer grade app. The admin of the app can do whatever they want. So we'll meet your need, but let us lead the effort.
Yeah.
So security engineer ended up being a Doodle admin, made sure all the settings were turned on. And it was only a temporary need, and we got them what they needed, and we moved on. And right now we're doing the same with Zoom. I mean, there has been a ton of news about Zoom, and we've taken a very surgical approach where we have figured out what the telehealth use cases are. They range from identity proofing to seeing somebody in an isolation room to scheduling appointments. So we have security recommendations for each of those use cases that can easily minimize some of the risks that are out there in the news. And the biggest one there is around Zoom bombing and just the use of private meeting IDs and passwords for your Zoom conferences, and education around not making those Zoom invites, sharing them socially on social media can go a long way to minimize Zoom bombing. So those are some of the things we've done.
That's terrific. And I know you're super busy because I can hear you blowing up over there electronically. Is there anything else that I didn't ask you about that you'd like to share with listeners before I let you go?
Yeah, sure. One more thing that has helped us tremendously through this entire journey has been early on within IT, we set up a point person who would field all COVID-related activities, and we had daily leadership huddles to prioritize, deprioritize COVID, non-COVID activities, remaining in line with the organizational principles. Initially, it was me, as I'm also responsible for business continuity planning. But as the activities kind of skyrocketed, we felt that there was a need to have a dedicated project manager focusing on all these tasks, because there was significant effort needed in between the leadership huddles with all the teams to coordinate this work. So having like a crisis director or a project manager dedicated to managing COVID activities has helped us significantly, not only from a documentation governance standpoint, but also making sure that all the teams are have the same priorities at all times, because requests are coming from left, right, and center.
I love it. Air traffic control for COVID in both the IT and the CISO world. That makes total sense. And you're the first person I've heard talk about managing it that way. So thanks for sharing that tidbit, man. That's terrific.
Yep. Thanks for the opportunity, and I hope your listeners find this helpful.
Like I said, I know your time is exceptionally valuable. Really do appreciate you being with us today. Thanks, Vic. Have a great day, and we really, again, appreciate you being here.
Thank you, Drex.
That's all for this week. Special thanks to our sponsors, VMware, Starbridge Advisors, Galen Healthcare, Health Lyrics, Sirius Healthcare, and ProTalent Advisors for choosing to invest in developing the next generation of health leaders. If you want to support the fastest growing podcast in the health IT space, the best way to do that is to share it with a peer. Send them an email, DM them, whatever you do, however you do it. Go ahead and do that, and that would benefit us greatly. We appreciate your support. Please check back often as we will continue to drop shows until we get through this pandemic together. Thanks for listening. That's all for now.